The CELON method is a minimally invasive, gentle, and user-friendly treatment for the thermal ablation of tissue. This video demonstrates how to use bipolar radiofrequency-induced thermotherapy at the base of the tongue to treat habitual snoring and mild obstructive sleep apnea. Before you use this method, make sure that a proper diagnosis of the type and severity of the sleep-related breathing disorder has been made. You can treat the tongue base with bipolar radiofrequency-induced thermotherapy using local anesthesia. It may be advisable to use general anesthesia for patients with a strong gag reflex and for those requiring multi-level treatment. First, disinfect the tongue base, for example with hexetidine. Then, extend the tongue and apply a topical anesthetic like lidocaine gel to the rear of the tongue. After that, it is suggested to use a long, curved cannula to inject 2 to 3 milliliters of a 2% lidocaine solution in each of about 3 points in the circumvallate papillae area. Wait for about 5 minutes, then use the CELON Pro Sleep Plus applicator to treat the base of the tongue. The power setting on your control unit determines the extent of coagulation induction. A power setting of 7 watts is recommended for treating the tongue. Depending on the size of the tongue base, approximately 9 coagulations in the circumvallate papillae area are recommended. Insert the tip of the applicator into the tongue muscle until the insulation tube touches the tissue. Be aware that the surface is difficult to penetrate. After each puncture, try to make more than 1 coagulation inside by partially removing and repositioning the applicator. After positioning the applicator, activate the power supply by pressing the foot switch. You can monitor the status of coagulation via the acoustic signal. The power supply is reduced automatically to prevent overdose effects. The application takes only a few seconds for each lesion, so the whole procedure takes about 15 minutes. The individual coagulation zones should be along the midline and approximately 1 centimeter apart to maintain a seam of untreated tissue between them. To avoid damage to the hypoglossal nerve, do not coagulate too laterally. You can expect a visible reduction in volume accompanied by a tightening of the tissue within 4 to 6 weeks as a result of scarring and the body's resorption process. If post-operative pain treatment is necessary, ibuprofen or diclofenac is recommended. Post-operative antibiotic prophylaxis is recommended using cephalosporin or clindamycin orally, for example, to avoid abscess formation. Because swelling at the tongue base may occur, your patient should be observed for a couple of hours following the treatment. Further treatment at intervals of around 6 weeks may be necessary to achieve optimal results. Olympus wishes you much success using the CELON method. For further information, please see the procedure guides or visit our website.